Good afternoon and welcome, everyone. My name is Carrie Craven. I'm the Administrative Specialist for KCMPA, and we thank you for sharing your time with us today. First off, on the screen, you'll see we have an invitation that we're extending to you and to your staff as well for a dinner event that we're hosting on Thursday, May 5th at 6:30 p.m. We will be gathering at Brio Tuscan Grill on the plaza. And we will be talking a little bit about the mission and vision of KCMPA, who we are, and our progress in building a clinically integrated network, followed by Dr. Michael Ogden, who is the Chief Clinical Integration Officer for Cornerstone Healthcare, who will be presenting on improving the delivery of patient-centered diabetes management and integrated team-based care. So we would love for you to attend that, learn a little bit more about us, and please bring interested staff with you. We do ask that you RSVP in advance. We do have to have that prior. And we ask that you watch for your email. We'll be sending out an invitation via email where you will have instructions as to how to RSVP for that event. So we'll hope you're able to attend that and join us for that. Again, I want to remind everybody that while the webinar is in progress, we ask that you please mute your phone line to ensure that everybody can clearly hear the presentation and we don't have any distractions. You can press *6 on the phone if you are on a landline. If you're using a cell phone, you can mute your line. If you should have any questions, you may ask those questions via the chat window during the presentation. We will get to those, or you can wait till the end and we will open the phone lines for Q&A. So joining me today is Cindy Campbell, Director of Clinical Strategies for KCMPA. And Cindy is going to talk about our membership and give some updates on these projects and initiatives. So Cindy, I'm going to turn it over to you.
Okay, great. Thank you, Carrie. I wanted to just say one last thing about the invitation that Carrie spoke about. If for some reason that you don't have, you don't think that you'll get an email or an invite to this into your inbox, please don't hesitate to reach out to Carrie or any of us here at KCMPA, and we'll make sure that that happens. So with that, let's get on with our webinar here. Let's just give me a moment to pull up the slides. Okay, can everyone see those slides?
Yes.
Carrie? Okay, great. Okay, so this is another part of our, another series, our presentation in our webinar series, and today we're going to be talking about KCMPA, who are our members. And the reason we decided that we should put this together is, you know, we get a lot of questions just, you know, how do we know exactly who our members are? Who should we be, you know, sending our referrals to if we want to refer within our own organization, and you know, where do we find that information? And so that's one of the things that I will be covering in this webinar today. And I also want to take the opportunity to talk a little bit about some of our other projects that we have going on, and what we foresee in the future as far as you know, future growth and future projects. Okay, so I have a list here of some of our upcoming webinars, and the May webinar, we would like to do our quality performance, our GPRO, and you know, we submitted in for the ACO, and just to kind of go over where we are with those, with our performance. Hopefully it will be back by that time. We will have those that report. If not, then we may have to just kind of move things around and one of our later webinars that we have planned, move it up to there. And then we would like to do a webinar on the state of KCMPA and just give a general update on everything that we have going on. And then our clinical integration project and what is happening with that. Okay, so for today's webinar, we're going to be talking about our membership. We're going to talk about our members and how we can go in and see exactly who our members are. And like I said, I wanted to take a little bit of time to be able to talk about a few other things around KCMPA, our capabilities, projects, and some partners, and our future vision. So KCMPA, as we stand today, our membership we have 320 providers, 56 practices. A third of those practices are primary care with 2/3 specialty and 6 allied health members. Our ACO is 86 adult primary care providers with 10 PCP practices with 14 locations. And we have 1 acute care hospital and 3 specialty practices. Okay, so I have some hyperlinks here because I want to talk about who our members are. And the easiest way to really show you that is to go into our website. So I have hyperlinks built in, and hopefully they will work. They worked when I was practicing this. So yes, here we go. So here is our website. And if you go along the top and you want to find a provider, then just click on Find a Provider. It's going to give you a list of all of our members of KCMPA. So as you can see, we have, and they're all broken up by specialty. So as you can see, we have quite a list of various specialties and different providers, healthcare providers. Try to get this to go. Oh, I guess. There we go. We have neurology, ophthalmology, pain management, pediatrics, and just on and on. So if we go through and you just click on that, it's going to then give you a list of the clinic and those providers at the clinic. So that's I think that's pretty easy. I think that's, I probably don't need to go into any more depth on that, but I think that, you know, if you're looking for a provider and you want to refer within KCMPA, this is the fastest way to go to be able to find out who is a provider that within the organization. So that would be your fastest way to go to find that. Finding a practice, I think this is where the map is, isn't it, Carrie? Okay, so finding a practice, we do have a nice little map here of the Kansas City metro area, and it shows a listing of all of our clinics and all of the clinics that are within the organization and where they're located. So once again, easy to find, easy to get to. You know, if that's a link that you want to put that one into your favorites. That way you always have access to it. Okay, so I'm going to stop there. Are there any questions about that before I go on? Sorry, now I'm trying to get back to my. Okay, here we go. Okay, so if there's no questions, I wanted to also show another area that where we highlight our members, and it's what we call the membership spotlight. And I also have that hyperlinked, so let's go there. So the membership spotlight, we do have this presented in at our board, at our monthly board. And then as well, we used to have a separate spotlight on our website. However, we decided to start incorporating them in our newsletter, and so they are in the newsletter. So if you just click on the KCMPA newsletter, you will get a list of, or you'll be able to see our spotlight. And let me open that up. And let me shrink that down just a little bit so it's easier to look at. And as well as getting to see some activities that are happening around the organization and different practices. So here is a spotlight, a practice spotlight. Consultants in gastroenterology was in our last one. And so then if you go down, you as well get a further list of our clinics. These are our clinics that do pay membership dues. We always list them out in the newsletter. So that is an area also where you can you'll be able to access our clinics, and you can always see a little bit more. Are there any questions around that? Okay. So if not, we'll go to the next one then. So let's talk a little bit about our capabilities. Clinical integration strategy. So we are currently working on a clinical integration strategy. I'm going to talk a little bit more about that on the next slide. Data aggregation for multiple EHRs. So as you know, we utilize HMS and their SQI tool, so that we will have the capability of being able to pull information, specific measures that we need from multiple EHRs, which leaves the freedom of the practices to be able to utilize any type of an EHR that they want to or they feel would be best for their clinic. Data reporting, the GPRO PQRS, is something that we have the capability that we do through KCMPA, a patient registry. All the clinics also have availability to a dietitian. They have availability to a certified diabetic educator. She works directly with the clinics and with patients in their clinics. We also utilize clinical pharmacists. We utilize a company called TRIA, and we do, they do approximately anywhere from 70 to 90 med recs, discharge medication reconciliation, and comprehensive med reviews on any patients for the clinics through, at least once a month. And then patient-centered medical home support and practice transformation redesign, claims and utilization analytics. We have reports which we put together and have those all organized and available for our clinics. We are in the process of looking at another company which will be able to enhance that as well and to give us even more meaningful data that we can feed back to the clinics in order to help them to, make better decisions and around how the care is delivered, and those high cost patients, and how do we increase our care coordination and care management around those patients. And with that, we have care coordination and care management capabilities and ongoing training for our care coordinators. So we have a health information exchange, LACI, and we currently, most recently, added on a clinical exercise program through a company called Simplified Health, and where she will go and work with those patients that have chronic illness, chronic disease, or need to be able to get up and do some physical activity, but due to either where they live or just availability of resources, they don't have always that option to do, and she will go out to the home and work with them on that. Okay, so let's talk a little bit about some of the projects that KCMPA is actively involved in. The Medicare ACO, that's the one that's the most popular that everyone knows, or most people do. We renewed for the second 3-year contract. It's 2016 through 2018. It's still upside only. And we signed that participation agreement in July 27th. Humana Medicare Advantage, so a lot of people have been working with Transcend, who is working with Humana. That contract went underway back in 2015, January 1st of 2015. Performance payments were paid in 2015 and expected again in 2016 and savings in 2017. And then the Cerner Primary Health Network, that contract went underway back in January 1st, 2014. Double the number of employers for the second year, and the next phase of that will add specialists. Okay, to continue on with our projects. So we are currently working on a commercial ACO with Blue Cross and Blue Shield of Kansas City. That's taking a select group of Blue Cross patients, and we anticipate that this is kind of a starting point, and we're moving fairly quickly with that to get that going. And based on how that goes, then we're hoping that we'll be able to increase that ACO as well and add more patients. Chronic care management program. So our chronic care management program began April 1st, 2016. Rachel Stevenson is the nurse that is running that program, and her title is a chronic disease patient coordinator. And we currently have 3 practices that we are working directly with. That is a payment sharing program. We share that reimbursement with the practice, and so we will be marketing this as well to other clinics to see who else would like for us to do their chronic care management for them. Clinically Integrated Network, or CIN. We are actively working with North Kansas City, Shawnee Mission, and KU with that program. Okay, and so our last slide here, our future vision. I think this is a really important slide, so that you all can kind of understand, that we do have all of these different projects in the works, and we also have a vision for what we want to see coming down the line, and that what we anticipate to put in place. So the chronic care management expansion is something that we are actively working on. We're kind of in the test phase of the new program, and we anticipate within a 3 to 6 month time period, we will be able to have a good solid list of patients that we have enrolled in the program, and a good process in place, and that we'll get to that place where we are going to need to hire more coordinators. Another project that we are doing a lot of discussion around is having a centralized transitions of care. And that would be where all hospital admissions and discharges are managed in one particular spot with one or two care coordinators for all of the clinics, so that we can ensure that we are catching all of those patients, either being admitted or being discharged or shown up in the emergency room, and that all of the paperwork, everything that needs to be, the discharge notes, all those notifications, that everything, we can streamline that to the practice and take that extra burden out of the practice. So that's something that we are actively discussing, and we're very excited to be able to put something together and get that going. And increasing the number of bundle programs that we have. So there's all kinds of opportunity around bundling programs with specialty care, especially things like open heart surgery. Trying to think, GI. There's a lot of various type of bundles with GI procedures, such as lat choles, different things like that. COPD, CHF. So I can kind of go on and on with that, but just to give you an example that these are happening, that it is currently happening out there in the country, and so we anticipate being able to bring those to KCMPA. We hope to further expand the number of commercial ACOs that we're involved in. That's why we're so very excited about the one that we're doing with Blue Cross, and making that a successful program so that we can be able to move that model over to other payers. Clinical integration, that's something that it is currently underway, and we want to keep that moving forward and going. And of course, increase our membership and our partnerships with various independent practices within the Kansas City market. And so if you know of anyone, if you're on this call and you're interested in joining KCMPA, or if you are aware of a healthcare professional entity that would be interested in joining KCMPA, please give them our names and our contact information, and we would love to talk to them. And one last note on that is KCMPA is really well aware of the value-based payment transition to MIPS, to the merit-based incentive payment system, and alternative payment models. And it is our intention that to be an APM, or an alternative payment model, so that KCMPA members will receive that 5% lump sum bonus payment and avoid the burden of MIPS. The work we are doing now to clinically integrate and to get to a place where the organizations can accept risk is aligned with that goal. So if you have any questions about that, then please don't hesitate to ask about our plans and how our plans can specifically relate to your practice. And as anything that we cover today or we discuss, please don't hesitate to ask about how any of these things apply to your practice, or how you can be more involved with any of these projects. We're very happy to discuss that with you. And once again, if you are listening on this call and you're not a member, I also want to invite you to our May 5th meeting that we are having. We're very excited. Please put the word out and also bring your colleagues or any other professional entities that you think would be interested. This is open to anyone that is about practice transformation, and not only practice transformation but healthcare transformation. So if anyone has any questions, that's about all that I have. Jill, did you have any comments or remarks?
I think you covered it quite well. I just I don't want to leave unsaid, and you didn't, because you covered it very well, about our plans to be an alternative payment model. We're in a Medicare ACO with that in mind. There is some discussion about whether or not we need to be in a different track in order for that to be in effect, but we're currently making those assessments and putting ourselves in a place where we could accept more risk in that program if necessary, because the primary goal is to make sure that KCMPA members can achieve those kind of protections and that significant lump sum payment through your membership in KCMPA, so that you wouldn't need to look for other mechanisms to do that. So I think practices are just kind of starting to think about their own business and what adjustments they're going to need to make in order to make sure they're in a good place come 2018 and 19. And so I just really like the opportunity to talk through that, really member by member if need be. I think people hesitate to ask questions because they think they should know the answers already, and that certainly isn't the case. That's not our expectation. We understand that practices are looking for people to talk through those things with, and I think KCMPA is in a place to be that for our members. So I just want to make sure that you're all aware of that and know how to put that in place if your practice would like that kind of discussion.
Okay, great. Thank you. Does anyone have any questions or any thoughts about anything that we discussed today? Okay, well, if you don't, we will go ahead and end today's webinar. If there are further questions that you think of and you just want to email, then please don't hesitate to email Jill or Carrie or myself. So thank you all for coming. I really appreciate your time, and have a good rest of the week.